respected doctors, teachers, students, and homeopathy enthusiasts from all over the globe. Welcome to the 2143rd day of the uninterrupted webinar series of the International Forum for Promoting Homeopathy. I'm Arya. I'm a third-year student from AMS's Homeopathic Medical College, Kottayam, Kerala. And today's topic is Organon is the heart of homeopathy, reminds us of the timeless works of our master, Dr. Samuel Hahnemann. The organon of medicine is not merely a textbook, it's the very soul and guiding light of homeopathic practice. It teaches us the principles of individualization, the law of similars, concept of vital force, miasm, susceptibility, and the ethical responsibilities of a true physician. Every successful homeopathic prescription ultimately finds its roots in the wisdom of the organon. The deeper we understand it, the more scientific, rational, and effective our practice becomes. We are deeply privileged to have with us today Dr. V.K. Karunakar MD, an eminent clinician, academician, and teacher with more than 14 years of rich clinical experience. He is currently serving as a medical officer at the Government Homeo Dispensary in Nellore and has previously served as an assistant professor at Government Homeo Medical College, Kadapa. He is also a senior consultant at Karina Homeo Care, Kadapa, Vinayaga Homeo Wave, Hyderabad, and Yashodhara Homeo Clinic, Nellore. His dedication to both teaching and clinical practice has inspired many students and practitioners. His vast experience and profound understanding of the organon make him the ideal person to enlighten us on today's thought-provoking topic. On behalf of the International Forum for Promoting Homeopathy, it is my great privilege to extend a heartfelt welcome to our esteemed guest speaker, Dr. V.K. Karunakar, sir. Sir, we are eagerly looking forward to your enlightening session. The virtual stage is all yours. Thank you.
Yeah.
Sir, if you could unmute.
Thank you, Aryate. Yeah, thank you. Thank you, Dhanesh sir, for giving this opportunity. Today it's a very different type of topic I would like to discuss about in front of all senior physicians and whoever interest towards the homeopathic family. So why I have taken up this topic is, so organon is the heart of homeopathy. So we know very well Trinity of homeopathy, Trinity of life, like that. So before going to discuss about the title of the topic, so I would like to bring into your notice certain problems. Why? Because every mind, whoever passionate of homeopath or not interested towards the homeopath, so if you are asking, if you are inquiring, so many doubts in their minds. So sometimes we are forwarded mechanically in the practice of homeopathy. Someone has raised questions, we are unable to give answer, or sometimes we are unable to understand the curative process. Recently, one example I have to give. So one of my student has consulting me on telephone. Sir, a lady patient was suffering, a pregnant lady. So she was suffering the heartbeat of fetus. That means baby heart rate is very less. Nearly 69 is there. Everybody knows the fetal heart rate is up to 150 is normal. So the allopathic physician means a gynecologist referred. So they are advised to abort. Why? Because there is no chances of surviving the baby, and also this is dangerous to the mother or like that. So they have given time for 3 days period. So wait for 3 days, and later he will come and try to abort, like that they are given. At that stage, my student was consulting me. She was asking me, so is it any possibility is there in homeopathy or not? So really it is a shocking question. Within 3 days period has given, and either previously I have treated such cases or not, I was revolved in my mind, and I have treated such cases in my past. I advised whenever the heartbeat is reduced, there is no fetal heart rate beginning in the conceived womb. So calcarea carb I have used. I read that statement in the Kent Metra Medica. I'm remembering. So sometimes I am unable to get the characteristic features. In this case, what I have connected on telephone consultation, they have suggested this is the pathological condition or circumstances, and there is no characteristic symptoms are available in the case or like that. Either I have to prescribe the remedy, I have to drop it out. So many conflict in my mind. But I have prescribed darenaply, calcare carb single dose. I have to administer to the mother, and at the same time, natrum muriaticum 6x. So every third hourly for 3 days period. And in addition to that, you have to add 10 drops of Cretagrus mother tincture, BID dose to the mother. So I was advised and forget it about that case. And I have received after 3 days period. So the allopathic gynecologist has decided after go to fetal scan and all other things, the baby heart rate is increased or rises 149 per minute. So I surprised her. She asked me how it works. Sometimes I am unable to. I have in my mind only one thing. Dr. Kent has described the calcare carb is a very good remedy, not only for the removing of the tendencies or whatever the soric tendencies are prevailing in the mother's womb or spreading from mother to baby or like that. It is a very good remedy for to increasing to control the heart rate, especially in that one. It is not only I used many times. The calcare carb is a very good remedy for to favor to improve the conceptive capacity. Every lady has a lady patient has conceptive capacity, but you have read Metra Medica Ken, so it clearly stated it has helps to increasing the capacity of the conception. So that means wherever the delayed mile or things are there, it may be corrected and other things. So that's why I have succeeded so many cases like that. It is the only my mind. But another application is why? Because there is no proper development of that thing. Maybe soric tendency. It is revolving in my mind. And bradycardia is there, hypofunctioning of the heart. It may belongs to soric manifestation. All our soric manifestations are there. There is no chance of psychotic or syphilitic tendency in the baby. So that's why I have to choose them. So how I answer to this question means based on the principles of organon, what I have read. So this is the thing. So looking at the prescription is very simple. Calcare carb on the basis of Metra Medica, whatever the statement I have read. But later on, I have to revolve myself. So why calcare carb works in this case within short period and the continuation of pregnancy is possible because of that one. So this is the thing. So the soric tendency has developed and the structurally or functionally, whatever the things. So sometimes we are unable to give exact pinpointed answer to why it works or how it works. One more case is also I have to treat it. Recently, I have conducted a medical camp on the event of government higher officials. So a patient was consulting MR office. So the Andhra Pradesh government has habituated to approach to conduct Ayush awareness camps in front of the government offices to promote our system of medicine. So many patients are not interested to take homeopathy. They are asking, they are preferably to go to the Ayurvedic. They know about something about Ayurveda and they know about the. But regarding homeopathy, majority of people they are showing some sort of regret. Everybody knows yes, it is a good system. Everybody it works very well. But come forward is not dare enoughly they are stepping into to take into that. One patient is very was tilted in front of the circumstances. So I called up. I recorded blood pressure is higher, 180 and 100 blood pressure is there. She was showing some amount of shivering and some amount of anxiety is there. So everybody was afraid to take because of he was given some application regarding his family issues in for solving in front of MRO all other things. So which remedy is suitable for him based on anxiety only? I have to because of that shaking of the body and the anxious phase and high level of blood pressure. These are the three indications. I have to give Econite single dose administration on the tongue, dilution directly pouring on his tongue. And I advise it to wait for some times. Everybody is observing in that circumstances. So the 180, 100 blood pressure is there. So within 5 minutes of time, I came to. He was consulting me, and again, sir, I am feeling comfortable now. Please check my blood pressure like that. Is it really? I was shocked. Is it really? Sometimes the patients are habituated. When I was worked as an assistant professor, I have checked like that everybody prescribed to the patient and how much time has taken. Some patients are replied in a for the sake of physician, they are giving wrong answer. Sometimes they are giving a right answer. I got a good result, all other things. So how I have a doubt, the patient answer is right or not, on which base we have to confirm. So in this case also I have checked blood pressure again. So the blood pressure is coming down to 140/90. So before 180/100 or later 140/90. So he was feeling. So I have to advise to continue the same remedy till tomorrow morning and he will go. So tomorrow morning also he will call and answering, sir, yesterday night I was slept very nicely. So I never observed such type of feeling. I have used anti-hypertensive drugs, but I never felt. So I many times I questioned myself. So many drugs are there. Sudden onset, if you take the sudden onset, belladonna is there, aconite is there, some other drugs also there for sudden onset. So why the aconite plays an important role or reducing the blood pressure? So if you looking, aconite and belladonna both are similar parallel. Acute onset and reducing, they are having affinity towards the blood vessels and heart, head, whatever the things. But which one is preferably acted on that circumstances? So little bit I have to compare. The anxiety is more prominent in aconite compared with belladonna. That is the only differentiating point is there in my mind. So, but some other cases, I got good result belladonna, but in this case, why aconite I have questioned. When I applied the principles, so I got answer this only because of anxiety, intensity of the symptom. Intensity of the symptom is also different from one remedy to that remedy. This finer discrimination is also very important. So similar like that, many patients are asked, so how long you have to continue the treatment? Is it any scope is there or not? So like that, sometimes every day I got OP in government dispensary, 30 OP or 40 OP is there nearly. So out of 40 patients, nearly 30 patients came with common symptoms. I have knee joint pains, I have headache, I have gas trouble, like that. So I inquired many times. I have given a questionnaire what I have read in 81 aphorism to 103 aphorisms, Hahnemann. So they never. I'm not having. I'm not having like that. Most of the times I am unable to get the characteristic symptoms in that. They understand. Please give me one medication. Either you have to give ointment or some other external application. They are insisting me to give some external application or some other things, or they are already experience with homeopathic remedies, mother teachers are like that. So I never prescribed that one. So in those cases, how I can select a good similar remedy to the patients? So a patient came with common symptoms or sometimes a label of diagnosis, hypertension, diabetes, or a peptic ulcer, or a pyloric infection. So, and also after taking the case, which one is characteristic, which one is not characteristic, many a times I am unable to differentiate that thing. And also, I have to discuss. Maybe I switched off the laptop, sir, because my voice is echoing.
Now it's clear.
Yeah. So, yeah. Here, after taking the case, how to find out the characteristic symptoms. So most of the times, very difficult to. In those cases, how I find a similar to the simillimum to the case or similar remedy to the case, and also different prescriptive modes. I have seen a number of senior physicians. They have their approaches are different. They have adopted a different methods in different situations. So here, which method is adaptable or suitable to this condition or not? And in different prescriptive methods explained in our literature, which one is exactly applicable here? Either on the basis of common symptoms, we have to go on the basis of characteristic symptoms, or similarly, many patients they brought their mental state is also they have habitually developed certain mental symptoms. That means irritability or some other things. They are brought into in front of us. Either they have importance in the selection of a remedy or not.
This is without confirming or without analyzing this thing. We are prescribing a remedy on the basis of mental symptoms. We are unable to get the good result maybe. And another important one is sometimes I taken up the case and I prescribe a remedy for a period of time. Very good result is there. So after that, even I have changed the remedy. There is no progress in that case. Repeatedly, the same set of symptoms are appear. Sometimes patient has given clear, I have free from all those symptoms, whatever I have earlier to your prescription, those things are completely disappear. After a 6 months period or 1 month, 1 year period, they visited once again the same set of symptoms. Meanwhile, what happened? Why the same set of symptoms are appear in the present status? I prescribed the same remedy, which one is exactly acted earlier. I have to administer to the same patient, but it won't give a proper result. How much result he got it earlier? So why? The same remedy worked earlier, now it doesn't work in the same case. So the why it fails. So like that, so many times, how I can move in these cases, or which any change in the remedy or potency or prescriptive method or some other is needed, implement the applicable in this case. That means mode of changing the life or changing the circumstances or changing or some other thing you want to add or not. So my mind is questioning itself how I can get the question. So similarly, I heard there is no scope in certain aspects. There is beautifully worked in certain cases. Is it right or not? So it is homeopathy is suitable for certain cases. That means a chronic diseases or a joint pains or some other things. So I go through literature, means Metromedica and repertory. So many disorders have mentioned, pathological conditions are mentioned, or disease labels were mentioned, certain strange symptoms are mentioned. So while reading those things, is it possible to get or observing these type of symptoms in the patient or not? I have doubt. But practically, we have seen the same the same type of symptomatology or rubrics in the patient. So I have developed a strong belief. So that means when I have find the symptom or rubric in a patient, the same thing which was existing in the Metromedica or repertory. So is a curable or not? Next question I started in my mind: is it curable or not? So definitely it is a curable. Why? Because the repertories and Metromedica are the products of experiment. So why I am unable to cure in those circumstances? Definitely there is a similarity. When I prescribed the same remedy, definitely we got it. So like that, so many doubts. There is some uncertainty has developed in my mind while treating the patients. So especially in hypertensive cases, diabetes cases, this patient, they are asked straightforwardly. So it is also like allopathic mode of treatment have been continued till the end of life or not. So how long we have to continue? So when I have to stop, when I have to change the remedy. So this type of questionnaire I have to facing in everyday practice. And also a few students asked me, so which Metromedica is good? Why? Because one Metromedica is there is no problem. Different types of Metromedicas presented by different authors. Each Metromedica is its own adaptability and criticism. So which one is good? So any shortcut method is there to read, or short guide is there for practicing of homeopathy? Or in present scenario, it is also very difficult to. So some people are saying in the YouTube or some other social media, they have listened and they are straightforwardly brought, this remedy is very good for this condition. Is it right or not? So yes, definitely 100% we have to reply. Answer is yes. Immediately I have to receive a question from the patient. I used, but I don't get the result. Why? They are asked me. So means this is a remedy for that. But in your case, in your situations, it may not be act. So that's why you are unable to get the result. So like that, I answered certain patients. So here is one more question many times. The Kent Metromedica was good, or Boric Metromedica was good, or some other. So if you have suggested to read all the mathematicas, it's a very difficulty to me, doctor. How far are like that? The students are replied very depressive or there is not interested to read all the things. So for all these reasons, so why? What is the question? Many a times, many a questions we have to raise or the lacunas in day-to-day practice we have to observe. So I read many times I have which one has solved or give answer to all these questions. So I find out. So in my opinion, not only in my opinion, everyone. So the answer is organon of medicine. If you read the history of, so in our body is also so many vital organs are there. Brain is there, lung is there, heart is there, liver is there, like that. So every organ is a very important. Here, not dismiss the importance of any organ, but the connectivity channel compare with all other things, either directly or indirectly, the heart plays an important role. It has the ability to control all the activities. Once heart is failure, heart is dead, there is no more. Even brain dead patients are for a period of time, they are not decided this man is dead, like that. So the heart is very important organ. It has ability to pump, to distribute the circulation all over the body, to control each and every function, to regulate that one, either directly or indirectly. So similarly, the organon of the medicine is the only. So if you see the history of development of that homeopathic system, so how the first experiment was the Cinchona bark experiment. So Hahnemann was dissatisfied with medical practice. He was started translations. The translations as creating some amount of doubt in his mind, and he tried to conduct the experiments, and he was making his own notes. So this is, and he tried to check out and conducting experiments and observe in many circumstances. Ultimate, he was giving one outcome, that product. So the organon of medicine is also the outcome product of the thoughts of Hahnemann's mind, which is to try to correct the principles, the literature which was existing at the time of Hahnemann regarding medical practice. He was studying each and every medical system. So why it works, why not it works, it doesn't work, and ultimate conducting the experiments, which one is the best for the sick individual. So which concept is best for sick individual, which principle is best for to cure the disease. So ultimately he was conducting so much experimentation. He was not at all directly a written organon of medicine. He was written the present essays, small essays and small articles. Ultimately he was making a biggest thing, that was the first edition of organon. Before that, so he was the ASEAN of new ascertaining the principles of that one, either medicine of experience or asclepiosity balance or three current modes of methods. So through which he was collecting the exact material, which one is good, all other things. He tried to correct the lacunas, and ultimately he was published in 1810, the first of organon. He was not stick on. After publishing that, anti-organon was started. So many questions are raised, but Hahnemann never depressed and tried to receive. He was understanding the queries and lacunas, whatever the raised by the anti-organon is, and try to conduct the experiments and try to convincing them, and he was solving according to that, changing the concepts. That means not changing the entire concept. He was just modifying the concept according to the existing literature. Many people are believing in the present scenario also, if Hahnemann was alive, there were so many changes were happening in the system of homeopathy, like that. So if you are asking the same question, may not be possible. Why? Because the ultimate changes are done in the sixth edition of organon. So regarding each and every concept, even nanotechnology, so nanoparticles, dynamization, everything has mentioned under that one regarding those. So if you have observed critically the first edition to the sixth edition, he has taken time, not immediately published another edition. What are the questionnaire or anti organon has raised by the others. So he received and conducting experiments and published. So try to correct in each and every edition. So regarding individualistic concepts, regarding principles, regarding concepts, regarding observations, so many. If you are see, the organon is nothing. So it is a book. The day, as per definition, it is a book and which guide us to practice of homeopathy like that. If you have critically observed, so the organon is the experimental product. So in which there are so many experimentations, so many observations. So only experimentation and observations and logical phenomena. So correlate each and one another. So related to the nature, related to the existing concepts at the time in the 16th century or 17th century. So many things were there. So they either good or not, how we are rectifying or how we are providing the better system or better principle to the sick individual. So like that. If you read Organon of Medicine, every paragraph gives there is a goosebumps or interest towards the homeopathic system. Ultimate homeopathy is superior than all other things. So homeopathy is a unique system. It is an individualistic science, and it was the not simply theoretically presentation. It was the experimental product. It was the full of experimentation and observations and universal applications. Universal. After that will not pertaining or limited to the single event. He was conducting experiments many things, even present. So at the time of Hahnemann, only 99 remedies he was used to cure each and every ailment. But now nearly more than 5,600 remedies are there. Different types of metromedicals are available. So many times we have doubt, raised questions. So is it need to learn 5,600 remedies? Is it possible to remembering? So there is a technology has developed for easy understanding, for easy reference, all other things. So here, whatever the things, the organon is the thought of Hahnemann's mind. So related existing medical systems, which one is the best for treating the sick individuality. And he was proposed many principles and many concepts and many guidelines to practice the principles, the homeopathic concepts, or how we are. So there is a linked up. If you, the Organon book has written in the aphoristic style, every aphorism, there is a linked up. There is a connectivity. In the case taking also, so theoretical part and Organon part, you have to see there is a connections. So he was conducting many experiments in those days regarding miasms, regarding the prophylactic activity or rabies, leprosy or cholera. So many diseases were prevailing which were, so which remedy is good, which principle is good. They are conducting experiments and they have proven on the basis of healthy proving, they are proposed healthy individual drug proving, they are confirming on clinical trials, later on confirming. So that's why everyone knows the organon is an important one. It is the guide to give answer for each individual minds has raised any question like that. But we are maybe somewhere we are neglecting. We are showing interest to read Metromedica, to show referring repertory, but no, we are not interesting to refer the organon of medicine. So heartfully have to question yourself how many times you have read a drug or Metromedica, the Metromedica is available in your rack, and how many times you have to refer for clinical purpose or whatever theoretical learning purpose, the repertories. So how many times we have to open up the organon of medicine and reading. So every time we have to read, there is something we have to learn. So through organon of medicine. So because of negligence, because of not interested to read each and every paragraph, every line given or written in the aphorisms point, we are not obtaining our position or not reaching our goal up to the mark. Many times we are vaguely why you have to give this remedy. We are showing based on the individuality, based on I have observed this symptom and so that's why. So is it really that symptom has presented in the case, on that symptom only the selected remedy works or not? Or sometimes I have received, while using the remedy, I don't get any result. After stoppage of the remedy, I got a good result, doctor. Why, doctor? So is it anything is there? Sometimes it gives a surprising answer, surprising to us. Yes, really, in certain cases, while using the medication, their symptomatology has increased, or sometimes they feel difficulty, but after cessation, their action has developed sometimes. And also, full of quarries are there. So you don't use certain remedies in certain cases. Don't take certain substances before this remedy or after this remedy. So in the Organon, Hahnemann himself proposed one theory, ade sapere. Ade sapere means dare to be wise. Whatever you have think, what you have observed, the concepts you have to express yourself dare enoughly. So anybody in the present scenario, any query, any question has raised regarding homeopathy, how many people come forward and give a scientifically logical answer to that one? We are simply escaping, even though we know very well, so many intelligent, logical persons are there in our department, but they are not come forward. So they are not even many our senior physicians were treated the greatest personalities, means ministers or sometimes some other film actors, all other things. How many people were there? And even we have taken the treatment from homeopathic point of view, they are not announced. Yes, I have taken homeopathy, so and so case, I am benefiting that one, and like that. Why? So this may be a lacuna. We are not even a intelligent man, intelligent physician. Silence is not the good step for development of our system of medicine. Come forward, who knows or everything, to not only criticize the concept, to give a positive answers whenever raised. For example, now there is a dengue fevers are there. Our government has decided, we know very well, for dengue, epitorium perp is very good remedy for to prevent. Some other remedies, Rastax, Zelsimin, so many remedies are there. Some research work is going on. So either we have good, even sometimes there is a good worthy result is observed, but in the next year there was no recognition. There we are not recognized up to the mark. We are not answering. So what I have observed is, so that's why whoever famous personalities in the system of medicine, they are open up your mind. They come forward to boost up whoever take as the inspiration of you or upcoming generation, all other things. So like that, why? Because the only answer I have found is maybe a lack of confidence towards the organon of everyone is a king in the master in the Mathematica. Everyone is a king in repertorial rubrics, but in the sections of organon, little bit come back. Some people, few people are interested towards that one, so that's why. So maybe this is the reason we are not obtaining that one. So Hahnemann was proposed each and everything connected. These are all trinity of homeopathy. So organon, Mathematica, repertory are the trinity of homeopathy. So Hahnemann has been grown to various editions. If you see that one, his tremendous work and experimentation, love towards the profession, his dedication towards the system of medicine, we have to observe. Such a type of dedication needed in the present scenario, or whoever practicing homeopathic people, then what Hahnemann will dream, so we will reach that position. So that's why organon is the base of the homeopathy, because it is a thought which has given birth to homeopathy, or a new thought or new investment to the medical practitioners. So Hahnemann, not only Hahnemann Hahnemannian ideology. So your own ideology adds something to that one. So it creates confidence towards the system of medicine when you have taken up the cases. So when you have confidence, when you know the concept, when you have understand the principle, when you have able to show that your knowledge applicability in the practical manner. So that's why these are all there suggested in organon of medicine. So that's why organon of medicine develop the thoughts and concepts in everyone's mind. If you perceive the aphorism right from one first aphorism to the 291 aphorism, so the either prospectively or retrospectively have observed the superiority of homeopathy and perfection of the principle of similia, the beauty of homeopathy you are showing in these aphorisms. You have every word, you have taken every word in organon of medicine, so specifically that thing. So that by here, every physician required three things: a knowledge of disease, a knowledge of medicine, and knowledge of application. So you are very master in the knowledge of disease, you are master in knowledge of drugs, that mean metromedica. But here come to the knowledge of application, there are so many confusions or lacunas. So regarding dose, regarding selection of remedy, regarding in different types of cases. One-sided cases are there, some local diseases are there, and where we have to use a constitutional therapy or miasmatic therapy, how to understand the individuals, or when there is no availability of symptoms, what we can do, and if some amount of results appear, after that, how we can forward that one, how we can end the case. So years together are, and also in the present scenario, some of the combinations were available in the market. We have to habituate, prescribe the combinations. Either combinations are worked or not. What is the utility of monopharmacy? These are all different questions. If you read clearly the organon, so very clear mind. For every question, which has arisen in our mind, there is an answer in the organon of medicine. Not only different types of symptomatology is there, different more kinds of prescriptions are there, and different methods or approaches of a study of the individuals are there. So these are all. So one approach is not useful in all cases. One method is not useful. So that's why Hahnemann never strictly decided this is the thing. He was given a guidelines. So where you have to use. So different types of different guidelines has given or proposed in the organon of medicine. You have to use this guideline according to your choice, according to the need of your patient. So like that. So even Metromedica also in the so many either fully complete Metromedica is there, or whatever the symptom which has mentioned, is it is a good or not. So to learn the Metromedica, one must masters Hahnemann's organon of medicine. So without knowing the organon or the drug proving concept and recording of the symptoms and clinical verification of the symptoms, we are unable to understand the materia medica. So are unable to prescribe the drugs which are studied in your materia medica. So the various concepts of homeopathy was nearly proposed 271 years back. Till now, there was no change. Everyone tried to disprove our system of medicine, but they are unable to. Everyone, they are accepting the homeopathic principles in the present scenario. Yes, this was right. Regarding mind concept, nanoparticle concept, dynamism concept. So these are all. So this miasmatic theory was there in Ayurveda, Vata, Pitta, Kapha. They are like that. So everyone is accepting. 200 years back, Hahnemann was proposed these theories, either maybe a cancerous theory. Cancer theory was there, vaccine, regarding vaccine, what he was proposed, those concepts are developing. The quantum theory, in the present, the allopathic people are following the quantum theory. The quantum theory means each specific disease, there is a specific medicine like that. So they are proposed. Hahnemann was proposed the same theory 200 years back. So in the how our drugs are working, how your medicine is benefiting, either case is curable or not, like that. So whatever every homeopathic man required the qualities of regarding knowledge of if you want to successful practitioner, you have to learn properly these organon principles, not only a case taking guidelines, case analysis, or understanding the auxiliary circumstances and different modes of treatment. So whatever. So I finally conclude. So what is mean by organon? To teach as is. So the regarding case taking, what is the purpose of taking? What is the purpose of collecting the symptom? What is the purpose of questioning? Questioning is more important, and which method is applicable to individualize that characteristic or sick individuality or drug. So how they are here the requirements also even Hahnemann was stated how the physician duties, how the physician behavior towards the patient, how the physician was performing or showing ability towards or without unprejudiced nature or sound senses. So really these are very, very important qualities. So in present scenario, there is no time to take everyone. This is also a biggest question. Few people are allotting the time more than 1 hour. They are questioning, and getting the details, all the other things. Another man may be half an hour, and another man only 1 minute time is there. So the variation of the time we have to spend with the patient himself observing why you are not asking like that. Is it need to ask or different uh, thoughts are developed in their mind. So leave it. Is it real? How much time we have to spend the patient? How much, how you are approaching the patient? These are all different questions. Hahnemann clearly stated in that one. And also, either if you want to decide, the first question patient asked by this, what is a disease is curable or not? Where you have scope. So the accidental cases are curable, or heart diseases are curable, or renal stones are curable. Cancer, here, so many questions we are raised. So for few, we have answer. For few, there is no answer. Why? Because we don't know. We don't experienced such cases earlier. We are not reading or studied in the literature which was proposed by some other senior physician, all other thing. If you read, we have learned something. We are same thing we have propagated or shared to the patient towards the patient or upcoming that one. And also, if you have decided either what is curative in disease, what is curative in medicine, so either disease is curable or not. In the first aphorism itself, Hahnemann was stated the highest mission of the physician, how the curative process is adaptable, highest ideal of cure, what are the requirements, and the practical part also, how we are discovery of medicine or proposed if you, any new medicine you want to discover or added to the public or market or any new suppose how you are preparing a new medicine, not only new medicine, sometimes all of we are unable to keeping all varieties of potencies. So one remedy has given to the patient, it works very well, but what our postology theory suggested, you have to increase the potency. There is no availability potency. You have only 200 potency. There is a requirement of 1M potency, but 1M potency is not available. What we can do? If you read Organon of Medicine, he was proposed water plussing method. So plussing method is very, very nice application and administration method. So recently, in many cases, there is no possibility of administration of the medicines. A small kid, 1 month baby or 2 months baby, Hahnemann clearly proposed in his Organon of Medicine to give a medicine to the mother, not the baby. So you have observed, you have to conduct the experiment, how many cases you are getting succeeded like that, or you have some in some auxiliary line of treatment means mesmerism or some other Hahnemann suggested where when the patient body is not responded to your medicinal action, you have to take the help of other things. So our minds are not accepting. Even patient said, I used so many things. Don't use like that. So many patients are asking either I have to stop the medication, allopathic medicine. A few people are prejudicedly stop the allopathic medication. Few people are on same prejudiced manner, don't stop. You have to continue allopathic medication and homeopathic medication. So a patient has raised the question, what is the use of taking homeopathic medicine in the continuation of allopathic medicine like that? So our answers are different, either satisfactory or dissatisfactory. I don't about it. But what is the clear methodology? What is the clear concept in those cases? Hahnemann was clearly stated, don't act like a criminal treasurer. You have act like a homeopathic physician. So similarly, certain people in our discussions also, different people, they have shared their own experiences by understanding the homeopathic principle. Some people are used only 30 potency. Some people are 200 potency. Some people are used along with homeopathic remedies, batch flower remedies, or biochemic tissue salt. A few people are habituated to prescribe mother tinctures. Why you have to use the these only? They said, I got good results, so that's why I have been continuing. But this is not a fair answer. Why you have to use the mother tinctures? Why you have to add the batch flower remedies to that one? There is a clear concept. Hahnemann clearly explained in each and every aphorism and footnote where you have to use, how to use, and all these things. You have explained properly. When patients are convinced, you can take help of others. We are not alone. Hahnemann himself stated that sometimes we are not alone do entire thing or complete thing can take. So that's why in the present scenario developed that concept integrated systems. So regarding those, so many confusions. One man stated that higher potencies are good. One man stated low potencies are good. But Hahnemann, if you read Hahnemann literature, yes, 30 potency is good and 1M potency is good, but it has decided by susceptibility of the patient or a disease condition. So, or patient condition, not our Metromedica, not us. So you have to use. So similarly, and when you have to repeat, the regarding repetition of the doses also, these are all practically important concept. A few people are given 5. This is also there one. Hahnemann clearly stated, if you take 5 pills of any homeopathic medicine at a time, or 200 or 2000 pills at a time is equal to one dose only. So some patients are, this is also have done by a few patients, they are taking 5 pills, not getting good result. They are used 10 pills or 20 pills like that. They are stated, I used 20 pills, I got good result. If you are suggested only 5 pills, I don't get doctor 5 pills with 5 pills. So like that. Is it a true? What our science suggested to us, our variation is there. Few people are suggested only 1 pill, few people are 5 pills, or few people are 10 pills. Like that, there is a disparity is there. Not there is no uniformity in the prescriptive method, uniformity in the explanation method, uniformity in the administration method. Like that, very clear guidelines are there. You have to follow guidelines through which there is a possibility of transparency and uniformity, then we will reach our heights. Every homeopathy has recognized as a official, great, honorable person in the society. So similarly, the perceptions regarding disease or concepts, the auxiliary line of treatment, all other things. These are all different modes. So some people are there. Even you have to read in the predictive homeopathy by some visual propulsor or the Sankarans or some concepts are there. They are all the thoughts which are born their mind by studying and understanding the Hahnemannian concept only. So they are so like that. We are inspiring them and we following them. Nothing to wrong. But why? Because everybody has the main principle is same. And so if you read Organon thoroughly, so not only clarity or clearness in your mind, so you have to understand different people, their approaches, all other things. So, and regarding diet is also so many disparities are there. One physician decided don't take this one. Another man, you have to take that one. Nothing to worry is there. So there is no uniformity in that. It creates some amount of confusion in the patient's mind and in the public minds. So that's why when we are clarify and act like a unity in that aspect, then we will get in that one. So ultimate, I concluded my topic why the organon is the heart of homeopathy means the heart is a very important vital organ. Like that, it guided to control the each and every organ in the body. Similarly, the organon is the central core point which guide us to how to practice and how to understand the different subjects which are needed for practice of homeopathy. Either it may be mathematical, either it may be repertory, or it may be allied things. How we are acquiring that one, how we can utilize. This is an instrument you have to use according to the need, according to the situation. So for different types of concepts. So when you have to understand the each and every concept, you have developed clearness and confidence towards the practice. When you are confident, you are able to tackle any case. It may be even some patients are died within our hand, nothing to worry about it. Why? Because you are done good justice to the patient. So your duty is you have to perform the duty of the physician and regular justice to the patient. Either it may be right choice or right decision or right remedy to that one. So this is possible only by thorough reading, critically analyzing the concepts and principles suggested in the organon of medicine. So then only possible, through which we are clear mind and confidence in our mind towards the practice of homeopathy. So that's why there is a possibility of uniformity and transparency in the practice of homeopathy, through which only we are recognized as a great physician. Our system is a great system in the society. Thank you very much, sir. For any question is there, you have to raise as much as possible. I am not saying I have to develop each. Everyone is a great master. You have to share and dare enoughly come forward with your knowledge. Then it is inspiring not only upcoming things and clear clarity in the public.
Yes, as it was really a rocking performance from you. And the subtopic of discussion was organon is the heart of homeopathy. Yes, it is the heart. You really proved proved it's right. And if you there are many things in hormone footnotes, but nobody is reading. That's the reason why we are finding it very difficult to move whenever there is some problem arises. So every reading at least 1 hour a day is a very good thing to improve your quality practice. And that's what we gained from your presentation. And congratulations and thank you once again. And Dr. Ramparesh, sir, you can say a few words and then Arya can conclude the session. Please unmute.
Thank you. Thank you, Dr. Dhanesh, and congratulations, Dr. V. Karunakar. Very nice, wonderful presentation. Philosophy, organon of philosophy. Homeopathic science, science and art. Or homeopathic is the big science, broad science, and requisite qualification of physician. Organon is the must knowledge. Materia medica is the must knowledge. So homeopathic science is the gently, rapidly, and permanently your point of view. No suppression. Knowledge of organon is the essential. Thank you, sir. Very thanks. Behalf of IFPH, whole team, very thanks. Every presentation is a wonderful, good presentation. Thank you.
Thank you, sir. Thank you.
Yes, Ms. Aire, we can conclude.
Sir, can you conclude, because here my connection is gone. The current is gone actually. So
yes, we
you won't be
can
able
hear
to
you.
see.
You can say in a few words. Anyway.
Okay, thank you, sir.
Okay.
Thank you, sir. Thank you to all the participants who have joined today. I guess you must have, and to the speaker, sir, we thank you for your advices as well as the cases that you have shared, your experiences, and your talk about organon. It was very inspiring. And I thank all the members of IFPH, all those who are present in this webinar. Thank you for your time. And reminding again, in case you have missed any of our webinars, it's been daily uploaded in the IFPH Talks YouTube channel. Please do check it out. Thank you, everyone. Good evening.
Okay. Thank you, Ms. Arya. And tomorrow we will have a session from Dr. Rohit Srivasan, and the doctor will be talking about gallstone treatment through homeopathy. Thank you all. Good night.